Let's talk about something millions of us do without a second thought. Your back aches, your knee is acting up, you reach for an ibuprofen. It feels so routine, right? So harmless. But what if I told you that the real story behind these common painkillers is way more complex and frankly a lot riskier than you've ever imagined? Today, we're digging into the painkiller paradox.
I mean, this scenario right here is just so incredibly familiar, isn't it? This could be your dad, your neighbor, it could even be you. You've got this nagging pain that's starting to get in the way of your life, and the obvious answer just seems to be, hey, I'll just take one of these every day.
And that's the big question, right? Is this simple little pill really the right answer? Well, the truth is, it's complicated. And by the time we're done here, you are going to see exactly why.
Okay, first things first. Let's just get a sense of how incredibly common these drugs are. I mean, they're not just a staple in our medicine cabinets. They are a massive, massive part of our entire healthcare system.
11.5 million. That's how many prescriptions for oral NSAIDs were written in England in just 1 year. And get this, that doesn't even count the millions of packs we all buy right off the shelf at the pharmacy. The sheer scale it's just staggering.
So, how does this little pill actually work its magic? What's the science that so many of us are relying on every single day? Let's get into the mechanics of it.
Okay, so the name is a total mouthful, right? But the actual concept is pretty straightforward. When you get hurt, your body makes these little chemical messengers that create pain and inflammation. NSAIDs work by blocking the enzyme called COX that makes those messengers. So no COX, fewer pain messengers. Simple, right? Well, not quite.
And here is where it gets really, really interesting. See, it turns out there are two types of this COX enzyme. Think of COX-2 as the bad guy, the inflamer. He's the one who shows up at an injury site to cause all that pain and swelling. He's our target. But then there's COX-1, the protector. He's the good guy, the housekeeper who does important jobs like protecting your stomach lining. Now here's the problem. Older NSAIDs like ibuprofen are kind of clumsy. They can't tell the difference, so they block both the bad guy and the good guy. And that single fact, that explains everything we're about to talk about.
All right, so we know they're popular, and we have a basic idea of how they work. But this is where our story takes a pretty sharp turn. Let's look at what the actual clinical trials say about how much relief these things provide.
You know, this is the million-dollar question in any drug trial, isn't it? If you take away the power of belief, the placebo effect, what's the raw benefit of the drug itself? The answer? Well, it might just shock you.
So check this out. On a pain scale from 0 to 100, for acute low back pain, NSAIDs provide, on average, a 7-point improvement over a sugar pill. 7 points. For chronic low back pain, it's even less, just a 6-point drop. Even with something like osteoarthritis, researchers often say these differences are so small, they're not even clinically meaningful for a lot of people. It's kind of stunning, right?
In this slide right here, this really drives the point home. This is something called the number needed to treat. For spinal pain, that number is 5. That means you have to give an NSAID to 5 different people for just one of them to feel a meaningful benefit that they wouldn't have gotten from a placebo. For the other 4, it was no better than taking nothing. The benefit, it turns out, is way more modest than we think.
Okay, so on one side of the scale, we have a pretty modest benefit. Now let's weigh that against the risks. This is the other half of the paradox, and this is where things get serious. Remember how those NSAIDs block the good guy, the protective COX-1 enzyme? Well, that has some major consequences.
Yeah, this diagram looks complicated for a reason, because it is complicated. The effects of blocking those enzymes, they ripple all through your body. We're not just talking about a little upset stomach here. As you can see, we're talking about significant impacts on 3 huge areas: your heart, your entire GI tract, and your kidneys. Let's put some hard numbers to that risk. A massive study that looked at a ton of other studies found that taking a high dose of ibuprofen every day can more than double your risk of heart failure. And look at the GI events: ulcers, bleeding. Both ibuprofen and naproxen can basically quadruple your risk. Now compare that 4-fold increase in risk to that tiny 6 or 7-point drop in pain we saw. All of a sudden, that trade-off starts to look very, very different, doesn't it?
So who needs to be the most careful? Well, the risk of stomach problems isn't the same for everybody. It absolutely skyrockets if you're over 65, if you've ever had an ulcer, or if you're taking other common meds like aspirin, blood thinners, or steroids. It is absolutely essential to know if you're on this list.
Okay, so the picture is tricky. The benefits are small and the risks can be really severe. Now, this doesn't mean we should never use them,
But it does mean we need to be much, much smarter about it. So how do we build a smarter strategy? Well, the first step is to realize that a pill shouldn't always be the first line of defense. This ideal treatment plan shows us that things like practical advice and physical therapy should come before a prescription. A pill is just one tool in the toolbox, it's not the whole set.
And here's a game-changing piece of advice from the research. For localized pain, like in an arthritic knee, topical NSAIDs, the gels, creams, and patches, can be just as effective as the oral pills. But because so little of the drug actually gets into your bloodstream, you avoid almost all of those serious systemic side effects. It's a huge win.
If you do end up needing an oral NSAID, the choice really matters. This chart kind of breaks down how doctors think about it. If you've got a high risk for stomach issues, they might choose a more selective NSAID and add a stomach protector. If your heart is the main concern, studies suggest naproxen might be a safer bet. And if you have both high stomach and heart risks, the best option might be to avoid NSAIDs altogether.
So we can boil all this down to 4 simple rules for using NSAIDs smartly. Number 1, assess your personal risk profile. Talk to your doctor. Number 2, use the lowest dose that actually works. More is not better, it's just riskier. Number 3, use it for the shortest possible time. Think days, not months. And number 4, for pain in just one spot, always consider trying a topical version first.
Which brings us right back to the paradox. These drugs are so easy to get, so widely used, it makes them feel safe. But the evidence shows they are powerful medications with modest benefits and serious risks that really demand our respect. So I leave you with this question. Isn't it time we stop treating these powerful drugs like they're harmless candy?